you talk a little bit about the Project Walk program?
Yeah,
it's
basically Project Walk's basically an intensive training area where they focus on getting you out of the chair. I mean, they want to say, hey, listen, you're not restricted to that chair. I mean, the more we get up and use those limbs, rather than just keep them frozen, you're better. A lot of work. I mean, but if you're able to work, you'll find that the pain, the different things will go away. I mean, they'll lessen, which I found. Like when I take the weekends off, it's family time to do the things like that. Then it's more, yeah, I feel a little more burning sensation, and I feel a little more stiff, more spasms. They'll start coming on. So I find that to get rid of that is to work out, you know. And when I say work out, I mean just do something. Don't just sit in a chair. I mean, get out and try to think of moving those things and having someone, hey, can you lift up the leg and just do a couple of, do some reps, do something. Don't just sit in the chair.
Now you have kind of a neat relationship with your neighbor.
Yes.
Has taken on the trainer.
Yeah. She, we asked, actually she volunteered, and I suggested, well, if you're going to do it, why don't you come down to San Diego with us? That's where Project Walk is located. And next thing you know, she was coming down to San Diego. We had never planned it or anything. We were down there already. Wow. And so she was on a plane the next day, and she came down and learned all the therapy that he needed. And it's called Train the Trainer program. And so she and I and his father learned the program, and then a couple other of our friends came down and watched our son for us, so that we could actually pay attention to Ed.
Oh, awesome.
I have a high-energy 4-year-old at the time. So, speaking
hard, and you got to believe. And the most important thing is, when you believe in your head, things will move and they will happen. The day you stop believing that is going to be the day you'll be positioned on where you are and not advance and not move forward.
Well, we've even had doctors tell us they don't know everything yet. They don't understand the spinal cord all the way. It's so intricate. There's people who do get up and start walking and they can't explain why.
To have that drive. You have to have the drive in order to succeed. And when I say succeed, I mean if you're to succeed in the fact of regaining your life, mm-hmm. you know, and I mean this is function, yeah, regaining function, but life is tough when you get in a situation with an injury like this, and everyone's, if everyone's been in this situation, they're going to know this is tough. This is a battle. But the battle's on, and you've got to make something happen, or there's just nothing else out there.
I think one thing would be interesting to everyone would be, you have a kind of an indoor gym in your home.
Yeah.
Can you kind of talk about your workout and the sort of things you go after when you're working out, and how long you do it, and so on?
Like my wife says, like I even said, I work out at least a minimum of 5 to 8 hours a day. I wake up about 6:30, 7 o'clock every morning. I get up and I'll do some electric stim, which when each treatment's about 45 minutes long, and I probably do 2 treatments, and then from there I'll have some breakfast or something like that, and then I have the neighbor comes over. She comes over around 11:30 to 12:30 in between that time, and then we'll work out for about 3 hours. And the workouts consists of the Project Walk. They give you basically what a catalog you'd say, a book, a manual to follow their exercises, and those exercises, like my wife was saying earlier, consists of a person being your nervous system, working the legs, working the limbs, or whatever it's not moving, working it and trying to reconnect with those limbs again.
Trying to get a response.
Get a response and reconnect.
You actually want to see a spasm, like she'll pick up his leg, for example, and move it towards your chest. It's a stretching exercise too, but then on the way down you shake the leg, so it's really strenuous on you. And you're trying to see that the leg's responding. So when the leg stiffens up, it's almost like a response for that leg, like it's trying to do it itself. That's what you're trying to, get out of it. You're trying to get that body part to respond, and you want to see that he's feeling something in it. If he almost could feel like for a while that he was feeling her touching his leg, which was a very good sign. It comes off and on. it's never like you'll feel it every day. But
And I should add, the biggest thing also when you're working out with a type of injury like this is don't get discouraged. I mean, all of a sudden one thing, and you're gonna second guess yourself all the time. I mean, because you're gonna, oh, did I feel that? Or, ooh, did I not feel that? Wait to try to get 3 responses of it, and that gives you a good idea. Hey, okay, I'm starting to feel that. Not just and you. The big thing is you want to celebrate your victories. And each and every day you can't just say, oh, well, that's great, I just got that. No, celebrate it. Because when you achieve that goal, it gives you the good things inside that you need to keep going on. So, like I say, to finish up my workout, I'll finish it up in about 3 hours or so. And it's long and it's intensive, but, hey, sitting in this chair is long and intensive as well. So, do you want to get out of the chair, or do you just accept where you are? I guess that's the kind of person you got to really ask yourself. And then, so from there I'll go on, I'll get done with that, the kids will get home, and then we'll have some dinner or something like that, and then I'll sit down watching TV. And the convenient thing about the Nero 1000 electric stim is that the fact that I can sit there and visit with the family and do the treatments along with visiting and watching TV or reading a book or whatever it may be.